move straight on to my good friend Stella Bivol, who is the director of a major NGO in Moldova, PAS Center. Stella, over to you.
Thank you, Paul, and good day, colleagues, dear colleagues from East and West. I'm honored to be on the panel and speak on behalf of civil society in Eastern Europe and Central Asia. For those who know our work, who don't know our work, we manage a grant in 11 countries in Eastern Europe and Central Asia to accelerate people-centered models and TB response through health system strengthening and community system strengthening approaches. So for our team, working since 2016, working on Zoom has been routine, our new normal, to keep the 11 countries engaged. However, in 2020, in March, we quickly realized this would be our basically single tool to continue our work with the countries. We really quickly grasped the importance of being agile in times of uncertainty and understanding we are in for a marathon, not a sprint. So we started in March with developing a contingency and risk assessment and contingencies tool that we have shared with our partners and the NTPs that we're only starting to grasp the magnitude of what was coming. So I wanted to share with you a visual to see what the COVID pandemic is going to pose for them. So the idea of to see which ones were at risk the most. So and the time for this, it was still in the early stages of understanding the magnitude. So you can see by the color that the countries were in very different places. So for the health system elements, what you can see here is that basically in the governance and planning, health product management, monitoring evaluation, except for the community-led part, the NTPs were feeling that they were doing okay. With the outliers, obviously some were feeling okay across the board, while others were feeling the red is high risk, yellow is medium, and green is low risk of disruption. At the same time, moving to human resources for health and advocacy and social mobilization, you can also already see that the people started getting concerned, and it was obvious for obvious reason. Frontline workers, and no one knew the rate of infections that the healthcare workers will be subject to, and as well there were a number of countries who felt that the community-based work on advocacy and social mobilization is likely to suffer during the COVID pandemic. Now moving to the TB response, what you can see is again from the outset, the countries were feeling that they have a good grasp on diagnosis and treatment, and they were able to ensure essential services and service continuity for both MDR and sensitive TB, including patient support. They felt a bit less confident about the community-based patient support, but it was already clear that the TB prevention and the case detection, case finding, both active and passive case finding, were at the highest risk, and those were the areas that were already lagging behind the treatment targets. And the final observation for this one is that you can see that the range of perception was determining the anticipated risk. What happened, we already heard yesterday from the NTPs, the level of distress and disruption, so I will not stop on that. So let me move to the next point I wanted to make about the perspectives of civil society organizations about their work during the COVID pandemic. To reflect the ground experience, grassroots, we have asked our partners and countries to provide their views on challenges, adaptations, and outlook for the future. And the civil society organizations we worked are varied, including service providers of both HIV and TB services and key populations, and community-based organizations with people affected by TB, working mostly on advocacy, removing barriers and meaningful engagement. So the challenges on the community side, as they were perceived, were an acute distress for people who were in care that needed food support and basic needs during the lockdown. Another one, a specific one, was a very difficult outreach, particularly to homeless people who were very difficult to reach during the quarantine and prisons, because they kind of locked out of the external world. Shortages in PPE and restricted mobility, decreased community testing and case finding, telework not accessible to everyone, disruptions of face-to-face activities and not meeting the program targets. On the health system side, decreased access to health services because of primary care, and repurposing of facility of TB staff was the most prominent. And the X-ray overload for even the little examples we had with civil society participating in the case finding, when they got to the health institution, the X-ray was a bottleneck. Access to X-ray is and continues to be a bottleneck because of the COVID pneumonia screenings. Some countries registered stockouts of methadone and buprenorphine, and the combination of COVID and reform had a negative. Yes, Paul. I will finalize with the upside. The civil society has adapted, and many have moved online and renounced to office space. The major change is basically more community-based outreach and supportive services, and home delivery of ART and medications, and support with client navigation and transportation to services, remote counseling. So the civil society has moved quite fast. And also they stepped up to help frontline workers and health system through decongestion, through support to health workers, and even support to COVID-19 needs. And there's a lot of optimism for moving forward, of finding very good and hopeful examples. And the last one, I want to just acknowledge the NTPs and the civil society organizations that have provided important information. Over to you. Thank you.